Imagine going for a routine health check and hearing your healthcare professional say, your kidneys aren't working as well as they should. The surprising part is that many people hear those words without ever feeling seriously ill beforehand. Kidney disease often develops quietly. In its early stages, it may cause no pain and no obvious warning signs. Many people assume the small changes they notice are simply part of getting older, when in fact their body could be asking for attention. The good news is that your body often gives you subtle clues long before kidney disease becomes advanced. The key is knowing how to recognize them. Today, I'll take you through 12 warning signs that may suggest your kidneys need attention. I'll also share the experience of someone we'll call Helen, whose small symptoms seemed harmless until a routine health check revealed something unexpected. Finally, I'll share practical steps you can take to help protect your kidney health. Let's get started. Welcome to Health After 50. I'm Dr. Tina Price. My mission is to help adults over 50 make informed health decisions through clear, practical, evidence-based health information that's easy to understand and apply in everyday life. If that's exactly what you're looking for, you're in the right place. According to the National Kidney Foundation, millions of adults are living with chronic kidney disease, and many don't realize they have it because the disease often develops quietly in its early stages. That's why understanding these warning signs can be so valuable. Before we begin, remember that having one or even two of these symptoms does not automatically mean you have kidney disease. Many of these signs can have other causes. This video is designed to help you understand what to look out for and when it's worth speaking with your healthcare professional, not to diagnose yourself. Now, let's look at the first warning sign. Warning sign number 1, constant tiredness. Have you been feeling tired almost every day, even after a full night's sleep? Many people over 50 assume this is simply part of getting older. While tiredness can happen for many reasons, your kidneys may sometimes play a role. Healthy kidneys help your body produce a hormone called erythropoietin, which tells your bone marrow to make red blood cells. These red cells carry oxygen around your body, giving your muscles and organs the energy they need. When your kidneys are not working well, your body may produce fewer red blood cells. As a result, you may feel unusually tired, weak, or even short of breath during everyday activities. Research has shown that people with chronic kidney disease can develop anemia because damaged kidneys produce less erythropoietin. This reduction in red blood cells means less oxygen is carried around the body, which may lead to persistent tiredness and weakness. You might notice that climbing the stairs feels harder than they used to, or that you need to sit down and rest after doing simple jobs around the house. Persistent tiredness doesn't always mean kidney disease, but if it continues or appears alongside other warning signs we will discuss today, it's worth discussing with your healthcare professional. Now let's move on to another sign that many people dismiss as normal aging. Warning sign number 2, difficulty in concentrating. Have you ever walked into a room and forgotten why you went there? Or found it harder to focus on a conversation or remember simple things? While occasional forgetfulness is common, persistent brain fog can sometimes be linked to reduced kidney function. Healthy kidneys remove waste products from your blood. When they cannot do this effectively, those waste products may gradually build up, and this can affect how alert and focused you feel. Some people describe it as feeling mentally cloudy. Others say they simply don't feel as sharp as they used to. Of course, there are many possible reasons for memory changes, including stress, poor sleep, vitamin deficiencies, and other medical conditions. But if difficulty concentrating is happening together with tiredness or several of the other signs we're discussing today, it's another reason to mention it during your next healthcare appointment. Now let's look at a physical sign that many people notice without realizing it could be important. Warning sign number 3, swelling in the feet, ankles, or around the eyes. Take a moment to think about your feet and ankles. Do your shoes feel tighter by the evening than they did in the morning? Have you noticed marks left behind by your socks or puffiness around your eyes when you wake up? Healthy kidneys remove excess salt and water from your body. When they aren't working efficiently, that extra fluid can build up instead of leaving your body through urine. This can cause swelling, especially in the feet, ankles, lower legs, or around the eyes. Some swelling can happen after standing for long periods, during hot weather, or because of other health conditions. But if the swelling is persistent, getting worse, or happening together with other warning signs, it's worth having it checked, because sometimes what looks like a small inconvenience is actually your body's way of asking for attention. Coming up next, we'll talk about changes you may notice in the bathroom, some of the most important clues your kidneys can give you. Warning sign number 4, foamy or bubbly urine. Let's begin with something many people notice but rarely think much about. Have you ever looked into the toilet and seen foam or bubbles in your urine? A few bubbles every now and then are usually nothing to worry about. They can happen if you're urinating with a strong stream or if the toilet water reacts in a certain way. But if your urine is consistently foamy and the foam stays for a while before disappearing, it could be worth mentioning to your healthcare professional. Why? Healthy kidneys act like tiny filters. They keep important substances, such as protein, inside your bloodstream while removing waste through your urine. If those filters become damaged, protein may begin to leak into the urine. This is called proteinuria, and one of the first things people may notice is persistent foam. The National Kidney Foundation explains that protein in the urine is often one of the earliest signs that the kidney's filtering units may have been damaged. That's why persistent foamy urine should never be ignored, even if you feel perfectly well otherwise. The only way to know for sure is with a simple urine test, which is why it's important not to ignore this sign if it keeps happening. Let's move on to another warning sign you may notice when you use the bathroom. Warning sign number 5. Changes in urine color. This next warning sign is another one you may notice in the bathroom. Healthy urine is usually pale yellow to light amber, depending on how much water you've been drinking. However, if your urine becomes dark brown, cola-colored, pink, red, or contains visible blood, it's important to have it checked. There are many possible causes. It could be a urinary tract infection, kidney stones, certain foods or medications, or a problem affecting the kidneys themselves. The important thing is this: blood in your urine should never be ignored, even if it happens only once. Although it doesn't always mean kidney disease, it's a symptom that deserves medical attention. Your healthcare professional can perform simple tests to find the cause and decide whether any further investigation is needed. Warning sign number 6, needing to urinate more often at night. Now let's talk about something many older adults experience. How many times do you get up during the night to use the bathroom? Once occasionally may not be unusual, especially if you've had a lot to drink before bed. But if you're waking up several times every night and this is becoming your normal routine, it's worth paying attention. Healthy kidneys help control the balance of fluids in your body and concentrate your urine while you sleep. When kidney function begins to change, that balance may also change, leading to more frequent trips to the bathroom during the night. Studies have found that changes in urination can occur as kidney function declines. However, frequent nighttime urination can also be caused by other conditions, such as diabetes, an enlarged prostate in men, certain medications, or bladder problems. That's why it's important to have persistent symptoms properly assessed rather than assuming they're simply part of getting older. That's why it's important to look at the overall pattern, not just one symptom on its own. If frequent nighttime urination is happening alongside tiredness, swelling, or changes in your urine, it's a good idea to mention all of these symptoms together at your next appointment. So far, we've looked at 6 warning signs that many people brush off as just getting older. But the next group of signs often surprises people because they don't seem connected to the kidneys at all. Now let's take a closer look at Helen's experience. Helen's small symptoms seemed harmless at first, until a routine health check revealed something unexpected. As you listen, see if any part of Helen's experience sounds familiar. Sometimes it's only when several small symptoms are put together that the bigger picture becomes clear. Let's begin. Helen is 68 years old. She enjoys gardening, looking after her grandchildren, and taking short walks with her husband. Over several months, she noticed a few small changes. She felt more tired than usual. Her ankles were slightly swollen in the evenings, and she was getting up 2 or 3 times every night to use the bathroom. She didn't think much of it. She told herself, "I'm getting older. This is probably normal." A few weeks later, she began noticing that her skin felt unusually itchy, especially at night. She bought different creams from the pharmacy, but nothing seemed to help. Eventually, during a routine health check, her healthcare professional ordered a simple blood test and a urine test. The results showed that her kidneys were not working as well as they should. The good news was that it had been found before it became a medical emergency. Helen's story reminds us of something important. Most kidney problems don't begin with one dramatic symptom. They often begin with several small changes that are easy to dismiss on their own. That's why learning these warning signs matters. If you're finding this information helpful, I'd like to invite you to subscribe to Health After 50. My goal is to make complex health topics simple, practical, and easy to understand, so you can make informed decisions with confidence. And if you know someone over 50, a parent, partner, family member, or friend, consider sharing this video with them. It might help them recognize a warning sign they didn't know was important. Now let's continue with the remaining warning signs. Warning sign number 7, persistent itchy skin. The next warning sign surprises many people. What does itchy skin have to do with your kidneys? Quite a lot in some cases. Healthy kidneys help remove waste products and keep minerals in your body balanced. When kidney function becomes reduced, waste products and certain minerals can build up in the bloodstream. This may lead to itching that doesn't seem to have an obvious cause. People often think it's simply dry skin, allergies, or the weather. But if the itching is persistent, affects large areas of your body, and doesn't improve with moisturizers or other simple treatments, it's worth mentioning to your healthcare provider, especially if you're also experiencing some of the other warning signs we've discussed today. Warning sign number 8, loss of appetite, nausea, or a metallic taste. Have you noticed that food doesn't taste the way it used to? Or perhaps you've lost your appetite without trying. Some people with reduced kidney function describe having a metallic taste in their mouth or feeling slightly nauseated, especially in the morning. This can happen because waste products that should normally be removed by the kidneys begin to build up in the blood. As a result, eating may become less enjoyable, and some people gradually lose weight without intending to. Of course, many other conditions can also affect your appetite. But if this change continues for several weeks and occurs alongside other symptoms, it's another reason to arrange a checkup. Warning sign number 9, muscle cramps, especially at night. Have you ever been woken up by a painful cramp in your leg during the night? Muscle cramps become more common as we get older, and they often have simple explanations such as dehydration or overuse. However, your kidneys also help keep important minerals like calcium and potassium in balance. When these minerals become unbalanced, muscle cramps can happen more often. If your cramps are becoming more frequent, more painful, or are happening together with several of today's warning signs, it's worth mentioning them during your next healthcare appointment. Your body has a remarkable way of giving small clues when something isn't quite right. The important thing is to notice those clues before they become bigger problems. We've now covered 9 warning signs. The final 3 signs are particularly important because they may suggest that kidney function has declined further. After that, I'll share 3 simple things you can do this week to help look after your kidney health, along with one useful question you can ask your healthcare professional. Let's continue. Shortness of breath. The 10th warning sign is shortness of breath. Now, there are many reasons why someone may become breathless, including heart or lung conditions, so this symptom does not automatically mean there's a problem with your kidneys. However, reduced kidney function can sometimes contribute in 2 ways. First, when your kidneys don't remove extra fluid effectively, that fluid can build up in the body and, in some cases, affect the lungs. Second, as we discussed earlier, reduced kidney function may lead to fewer red blood cells being produced. With fewer red blood cells carrying oxygen around your body, you may find yourself becoming breathless more easily during everyday activities. If you're experiencing new or worsening shortness of breath, especially if it's severe or comes on suddenly, seek medical advice promptly. Warning sign number 11, high blood pressure. That's difficult to control. The next warning sign is high blood pressure that becomes difficult to control. Many people don't realize that the kidneys and blood pressure work very closely together. High blood pressure can damage the tiny blood vessels inside the kidneys over time. At the same time, damaged kidneys can make it harder for your body to regulate blood pressure. This creates a cycle where each condition can make the other worse. If your blood pressure has been creeping up despite taking your medication as prescribed, or if your healthcare professional has needed to increase your treatment several times, it's worth asking whether your kidney function should be checked as part of your assessment. Warning sign number 12, swelling that gets worse. While you're passing, less urine. The final warning sign is persistent, swelling that happens alongside passing much less urine than usual. If your ankles, feet, legs, or hands are becoming more swollen, yet you're noticing that you're urinating far less than you normally do, your kidneys may be struggling to remove excess fluid and waste from your body. Many people assume they're simply drinking less water or blame the swelling on getting older. But when these two symptoms occur together, they deserve prompt medical attention. On their own, they don't always mean kidney disease. However, when they appear alongside several of the warning signs we've discussed today, they could be an important signal that your kidneys need to be checked. The encouraging news is that kidney disease often progresses slowly. When it's identified early, there are treatments and lifestyle changes that can help slow its progression and protect your kidney function for years to come. Don't ignore what your body is trying to tell you. If these symptoms sound familiar, arrange an appointment with your healthcare provider for an assessment. 3 things you can do this week. Before we finish, here are 3 simple things you can do this week. First, pay attention to your body. If you've noticed several of today's warning signs, don't ignore them or assume they're simply part of getting older. Second, if you have conditions such as diabetes or high blood pressure, continue taking your medications as prescribed and attend your regular checkups. These conditions are among the most common causes of kidney disease, and managing them well can help protect your kidneys. Third, if you're due for a routine health check, ask whether a kidney function blood test, called eGFR, and a urine test for albumin would be appropriate for you. These simple tests can provide valuable information about how well your kidneys are working. Let's quickly recap. Today, we've covered 12 warning signs that may suggest your kidneys need attention. Remember, experiencing one of these symptoms doesn't necessarily mean you have kidney disease. Many of these signs can have other causes. What matters is noticing patterns, especially if several of these changes occur together or persist over time. The encouraging news is that kidney disease can often be detected early with simple blood and urine tests, giving you and your healthcare professional the opportunity to take action before more serious damage occurs. If you found today's video helpful, I'd love to invite you to subscribe to Health After 50 and turn on notifications so you never miss a new video. Our mission is simple: to help adults over 50 better understand their health through clear, practical, evidence-based information you can trust. And if you think this video could help a friend or family member, please share it with them. You never know, one share could encourage someone to seek help sooner and make a real difference. Thank you so much for spending this time with me. I'm Dr. Tina Price, and this is Health After 50. Until next time, take good care of yourself, stay informed, and stay well.